Welcome to The Explainer. I am so thrilled to have you here today because we're going to unpack something that, well, on the surface, it sounds purely mathematical, but it's actually the ultimate truth teller in the world of corporate sustainability reporting. Here's a little secret for you. In the world of evaluating company performance, raw numbers often lie. Or, at the very least, they tell a highly distorted version of the truth. You see, when investors and analysts look at the sustainability and performance of managed care entities, basically health insurance providers, they're just bombarded with data. But how do you know if that data is actually painting an accurate picture? Today, we're setting up a bit of a detective story to find out exactly how the pros separate the signal from the noise. Okay, let's dive into this. Just imagine for a second you're an analyst, and you're evaluating two competing managed care health plans based on their sustainability disclosures. Company A reports 1,000 patient grievances over the reporting period. Company B, on the other hand, reports just 50 patient grievances over that exact same time frame. If you had to make a snap judgment right now, based purely on this raw grievance data, which health plan is failing its members more? I mean, it seems wildly obvious, right? 1,000 is a massive number compared to 50. But actually, here's why that assumption is incredibly dangerous. Without context, raw data is a trap. It leads to wildly inaccurate comparisons that can completely skew market valuations and really erode stakeholder trust. You see, evaluating sustainability risks, things like patient dissatisfaction, data breaches, or access to care, it isn't just about counting up incidents. It's about understanding the scale of the operation where those incidents occurred. We literally can't answer which health plan is performing worse yet because we're missing a critical piece of the puzzle. To solve this mystery, we need to introduce the secret weapon that savvy investors rely on. It's defined right in the introduction of the SASB standards framework. SASB includes a very specific tool called an activity metric. The standard defines this as a metric that quantifies the scale of specific activities or operations by an entity. Crucially, its entire purpose is to be used in conjunction with other metrics to normalize data and facilitate comparison. Normalize is the magic word here. It means taking raw, wildly varying data points and converting them into a standardized format. That way, you can actually compare a colossal multinational corporation side by side with a regional startup. Now, what's really interesting about this slide is the exact code and phrasing the managed care industry uses as its baseline activity metric. Right there under SASB code HC-MC-000.A, we see it, number of enrollees by plan type. It's just a quantitative number. That's it. That is the foundational activity metric for the entire managed care sector. By tracking the total number of individuals enrolled in a plan and breaking it down by the specific type of plan, the SASB standard gives us the denominator we desperately need to make sense of all the other complex sustainability data. Knowing the number of enrollees by plan type absolutely unlocks the power of normalization. It allows us to transform those misleading raw numbers into fair apples-to-apples rates. Just think about it. A managed care company with 10 million enrollees is naturally going to have way more customer service calls, more data to protect, and yes, more patient grievances than a company with only 10,000 enrollees. It's just the law of large numbers. By using the enrollee count as our baseline activity metric, we strip away the distortion caused by the sheer size of the company. We stop obsessing over total volume and start looking at frequency and proportion. Let's move forward and see how this builds directly into the SASB standard-specific calculations. If we look at the metric for plan enrollee grievance rate, which is code HC-MC250A4, by the way, SASB doesn't just ask for a tally of complaints. No, it demands a normalized rate. Step 1 is to count the total grievances, basically any dispute expressing dissatisfaction with the healthcare services. Step 2 is where the activity metric comes in. You calculate the monthly average enrollees, and then divide that by 10,000. Finally, step 3, you divide the raw grievances by that enrollee figure. What this does is give you a rate per 10,000 enrollees. It completely levels the playing field. So let's apply this math to our opening mystery. Remember Company A? They had 1,000 grievances, but when we apply the activity metric, we see they have a massive 1 million monthly average enrollees. Following the formula, their normalized grievance rate is just 10 per 10,000 enrollees. Now look at Company B. Sure, they only had 50 grievances, but they're a tiny plan with only 10,000 monthly average enrollees. Their normalized rate, 50 per 10,000 enrollees. The truth is revealed. Once normalized by the activity metric, Company B actually has a grievance rate that is 5 times worse than Company A. If you had only looked at the raw data, you would have made a catastrophic miscalculation about which company is actually managing its plan performance effectively. So the crucial point is exactly what the SASB standards introduction tells us. The true value of this reporting framework relies entirely on this baseline comparison. Without the activity metric, investors, regulators, and everyday consumers are essentially flying blind. You just cannot accurately assess sustainability-related risks that could reasonably be expected to affect an entity's cash flows or cost of capital, if you don't understand the scale at which those risks are occurring. The activity metric is the great equalizer. And this brilliantly illustrates how the activity metric acts as the structural foundation for almost every other critical topic in the managed care standard. It isn't just about grievances. When the standard asks for data on improved outcomes, it doesn't want just the total headcount of people in a diet or mental health wellness program. It wants the percentage based on the monthly average number of enrollees. When looking at customer privacy, a hugely vital issue with the rise in cyber attacks, the standard requires knowing not just how many data breaches occurred, but the total number of unique customers affected, which is contextualized by the size of the customer base. Whether it's calculating medical loss ratios under access to coverage or tracking enrollee retention rates, the number of enrollees by plan type is the vital denominator that makes these sustainability metrics meaningful and actionable. It completely changes how you read a corporate disclosure, doesn't it? It proves that in the managed care industry, and honestly across all sustainability reporting, data without scale is just noise. So I'll leave you with this final thought to ponder the next time you see a company touting what looks like an impressively low number of incidents or complaints. Without the activity metric to normalize the data, what are those numbers really hiding? Thanks for joining me on The Explainer today, and keep questioning the data.